Thank you, everyone. Truly, it is an honor to be here, and as so many know, I'm so excited to share what I've been up to for the last several years, because we're moving the pendulum, and that's what I want to do. I bold, underline, and italicize treat, because hyperbaric oxygen, we are treating concussions, and we are able to say that. Having the same trouble Dr. Hartz did. Oops. I was saying I have no disclosures, but I have taken some images off of the internet because talks are incredibly boring without them. So if any of my images offend anyone, my apologies. But treating a concussion, I want to share some of my background, talk about the severity of concussions, share our data in treating concussions, the cost of treatment versus standard of care, the progress we've made in the past year, and my hope for the future. Again, I did my general surgery training at University of South Florida. Tampa General did not have this incredible wing of the hospital. We slept on mattresses on the floor for a period of time because they were redoing the call rooms, and unfortunately I was 9 months pregnant at the time. So interesting times, but wonderful times in Tampa. But we did an enormous amount of trauma, and we would see patients come in and they were unconscious. So how do you monitor their progress when we intubate them and do all of these other things? They would have a pressure monitor placed. That's where we'd call Dr. Maroon and the neurosurgeons. And we did so many things then that now, 20 years later at least, it was the wrong thing to do. This particular patient, and I do have I took it off the internet, little man in the corner, I have no idea who this is, but he obviously has an elevated intracranial pressure because the head of the bed is elevated. And that's what we used to do. We'd elevate the head of the bed. We'd put them on blood pressure meds. We would try to do anything to decrease the intracranial pressure because we didn't want patients to herniate. And the skull is a fixed space with a tiny opening. And when patients herniated, then it was the organ donors that were called. And there was nothing we could do. And as surgeons, we have this arrogance that we can fix things and we want to do something. And if you know me, that's truly my personality. But now in 2019, we're more proactive, and the neurosurgeons will take pieces of skull off and allow the brain to expand and to swell outside of the confinement of the skull. And unfortunately, even at times, that's not enough. But if you think compartment syndrome, which is an FDA-approved indication for hyperbaric oxygen, my hope is we can readdress a conversation that a concussion really is a compartment syndrome. And if you look at the definition of compartment syndrome, for compartment syndrome as surgeons, we wanted to open the fascia to prevent nerve damage. So we've got the same aspect in the brain. So as Dr. D'Agostino said, fast forward to 2019 and 6 children later, I started doing wound care. And I worked in a hospital system. My children said, "Mom, you need to warn people when you're going to show wound pictures." So this is my warning. I was seeing what we could do with hyperbaric early on. January 2012, a girl was walking in Chicago in a pair of moccasins along the train tracks. She'd been at a party, everyone was drinking, she'd had a little too much to drink, she was disoriented. We saw her Monday morning. So here she is at presentation, and I know these feet don't match. She sent me one, but these are better pictures. But I noticed before, and this is not a good picture to show, but before and after, we were getting the cyanotic dying tissue back to life. And as luck would have it, I got an even better picture after being in Fargo. This is a gentleman that minus 22 degrees, that was without the wind chill, on New Year's Eve in Fargo, North Dakota. He was walking, one of his tennis shoes had a leak. He went to the wound center, not mine, and they cut off his overlying skin, which was horrifically painful for him, gave him a bottle of Vicodin and said, call us if you need a refill. It's January, we'll wait and see how you are in July as to whether or not you need an amputation. And really, that's the general surgeon standard of care for frostbite. Frostbite in January, amputation in July. His mom is a breast cancer survivor, posted on her Facebook post, what am I supposed to do? And someone said, what about the hyperbaric clinic? So they called, and you can see, do you see this blue, this cyanotic tissue? This is dying tissue. If we don't get the swelling down and get oxygen to that blue tissue is gone. Just one treatment, no more cyanotic tissue. After one treatment, this young gentleman did not need narcotics. So we've talked about a campaign of oxygen instead of opioids, and that will be a next chapter. But this is such incredible evidence to show all of the naysaying physicians, look, we are getting dying tissue back to life. This is the acute phase, though. This is the surgeon in me of let's not sit and wait around. But this gentleman sent me a picture from his dorm room. He ended up having 4 treatments before going back to college. And on January the 12th, he came back into town. He was fully epithelialized, a little dry. What's interesting, do you see this? This is kind of a blood blister. Do you see how purple it is? I didn't open it because I like things closed, but if you notice, he's a little blue here after his first treatment. All of those red blood cells under that blood blister are oxygenated. And we see several patients with traumatic hematomas that come in purple, and after a hyperbaric oxygen treatment, that whole area of bruising is bright red because all of that blood has been oxygenated. So those are pictures that even physicians who are naysayers have to look at and give pause. So the other aspect of my career in hyperbaric that I've been totally fascinated with, and perhaps even more so than oxygenating the tissue, is the anti-inflammatory effect. This is a wonderful 87-year-old female that, as you can see, you can't even see the vessels on her finger. She had pyoderma gangrenosum on her heel that took 3 years till she got to me, and we finally got her healed without hyperbaric. But when she developed this lesion, I said, you know, let's try. And this was, I cut all the dates off for HIPAA compliance, but this was after about 3 days, but you can see some wrinkling and her blood vessels showing through, and then this was less than a month later. So if you know the disease process of pyoderma, it progresses, it's excruciatingly painful. But we aborted that and got her turned around with just oxygen and pressure. So end of wound pictures. So here I am, a mom of 6, sitting on the ice rink and watching volleyball, and truly it's with all of my children in their sports. And I have extremely competitive children. I don't know where they get it. But watching a volleyball player, she was a middle and she was standing there, the ball was not even in play, and she tilted her head back, and she'd had multiple concussions. And when she tilted her head back, she crumpled and had to leave the court. And I'm sitting there thinking, what is going on? She reflared with just the bounce of her own brain against her skull. And so that's when, seeing what hyperbaric can do and knowing what I did on the trauma service, I thought, you know, let's look into this. What's going on? So we Google concussions. You know, there's no specific cure. Allow the brain to rest, more than 3 million a year. We all know, and Dr. Maroon would argue with this, but it is sensational news with the NFL players progressing to CTE. I personally think what was really missed in the headlines of this article was that there were 14 college students whose brains were donated to Boston University. Why were college students' brains donated to Boston University? It's because the families were concerned. So yes, I feel for the NFL players, but it's starting far sooner than the NFL now. And we know that it's having an impact. In Chicago, the numbers of football players are dropping. For the 5th International Conference in 2016. All of these authors got together. They had this very interesting, everything started with an R, but the only thing close to treatment was rest. And even with rest, out of the entire paper, it was 2 paragraphs. And they talk about managing sports-related concussions. Rest may promote recovery by minimizing brain energy. What can we do to improve brain energy? Improve brain oxygen. But there's insufficient data to support that complete rest reaches these objectives. So we need further study on how much rest a concussion needs, which just drives me crazy. In 2019, is rest the best we've got? We need to treat concussions. There is no treatment. We have management. And hyperbaric oxygen just makes sense. Why do they say exercise sooner? Because it may boost oxygen flow. So we know brain cells require an enormous amount of energy, and I tell the students it's like you're Michael Phelps and you've got to have 5,000 calories a day compared to those of us who sit in the office or walk around the office, that we should really be below 2,000 calories a day. If you're Michael Phelps and you need 5,000 and you're injured and you need 6,000 but you're only getting 2,000, you're not going to be performing at Michael Phelps level. So we've got to get you back to performance. We've got to get more oxygen to the brain to repair those cells so those cells can go back to function. So why not hyperbaric? We know it hyperoxygenates the tissue, it reduces swelling, especially in the acute setting, turns off inflammation in a way that it's rebalanced, and we have the neurogenesis and angiogenesis aspects. Part of what I wanted to do when developing protocols was not have problems comparing apples to oranges. What we set out to do was to define protocols very specifically so that we had clean data. An acute concussion we define as 10 days or less, and you'll notice the bottom line, acute on chronic. Those are kids who were post-concussive, who were struggling, who probably should not have been back to whatever they were doing, and they got another concussion. Those are the middle and the volleyball team who gave herself another concussion. Those are extremely difficult to treat. So we separated out the acute, we call subacutes everything in between chronics, and chronics used to be 6 months, then it was 3 months, and now it's 1 month. There's a pattern to kids are becoming post-concussive syndrome or having chronic issues, and we're recognizing that sooner rather than later. So typical of one of the patients I saw in Chicago, the pediatrician sent a boy who had a concussion. He was the soccer goalie, was hit against the goalpost by another player, then hit the ground. Question as to whether or not he lost consciousness. The pediatrician said, I know Denham's office is open at 7 in the morning, just show up. There seems to be a general theme of just show up, Denham will take care of you, but it is what we do, right, Megan? But he comes into the clinic at 7 in the morning wearing sunglasses, complaining of a headache of an 8 out of 10. We treated him that morning, we treated him that afternoon, we treated him again the next morning, and he was symptom-free. But he had to be cleared by a concussion clinic before he could return to soccer. So he's concussion-free, symptom-free when she sees him. And many of you have seen this before because this is kind of what fuels my fire. This individual, who's the associate director of the sports concussion program, writes back that hot therapy doesn't work. Well, she doesn't even know the acronym for hyperbaric. She quotes the Department of Defense study, which if you even read it, you would know the acronym wasn't HOT. And she says, the child felt better after 3 days, which is normal recovery. But mom insisted that it was the HOT. You're right, it was the HOT. I invited this person and all of the physicians that work in this sports concussion group to come to my clinic and watch a patient get better. None of them accepted my invitation. Saw another patient who was passed out, had a collision on the football field, loss of consciousness. He was taken off the field, by the ambulance stretcher, ambulance diagnosed with a concussion, go home, rest. The pediatrician, who's a partner to the other pediatrician, said, call Denham. He called, I was in the office on a Saturday, and I said, just come over. He comes in, about 6'4", how are you feeling? I'm okay. On the pain scale, how's your headache? 2 out of 10. I'm okay. I'm okay. I'm okay. Okay, you're here. Dr. So-and-so said, let's treat you. You're going to play football. Let's just treat you. He gets in, he comes out, and he stands up, and he goes, wow, I was messed up. And for me, it was like fireworks. Of course, a damaged brain is not going to be able to necessarily self-report. And so many kids over and over and over, and we've tried to come up with an objective question and we just confuse them, but so many kids will come out and I'll say, do you feel better than you thought you needed to? And they think for a minute and they're like, yeah, this was bad. This is good. I was so cloudy and I'm clear. And part of it is the expression on their faces. I wish we could videotape them, but I absolutely refuse to because they're minors and it would be taking advantage. But the look on their faces, the lights are on and someone is now home as opposed to this glaze, not even knowing what's going on. So, when the medical authorities are saying what Dr. Denham is doing is not okay, and you're seeing these great results, and you're just working harder, and you're working faster, and you know that concussions are a huge problem. Here, June 6th of 2019, it's a hidden epidemic, and so many potential cognitive and behavioral problems in children are linked to concussions. And when the gurus say, well, 90% get better in 10 days, but then the CDC does a study, I think it took them 5 years, but 14% of kids still need academic help at a year. How are 90% better in 10 days? What is better? Recently, it was September of 18, this study came out, and they were trying to pick out risk factors that ER physicians could use to say which concussions may be longer to recover. But in their data, they showed that 58% of the kids who came to their clinic within 10 days of injury, so our same definition of acute concussions, 58% still had symptoms at 28 days. I called, or I emailed, and I said, looks like a lot still have it even after that. 32% at 6 weeks. A third of kids at 6 weeks after a concussion still have more than 3 symptoms. That's the definition of post-concussive. And why? The symptoms are non-specific. So many people discount them. Kids don't really know. Kids may answer correctly. They may not answer correctly. We really have trouble with symptoms of a traumatic brain injury. But we have trouble with the reality of traumatic brain injuries as well. Kelly Catlin committed suicide. In her Stanford dorm room, she could be my daughter. Her father said after her concussions, she was not the same Kelly. And last night, I found this on CNN. I think this was from the Post. Jack Hatton, a 24-year-old Olympic hopeful, committed suicide, probably, because in the article they say Pedro, who was his coach, there was no indication that he was having trouble. But he's talked to Hatton's father about donating his brain to Boston. What does that tell us? He suffered a few concussions, and it says in the article, but he was treated. We got to do better than this. We talk about concussion management. There's no endpoint. There's this sliding scale. And if the kids don't even know what their symptoms are and they keep living these symptoms over and over and over, at some point they say, I think I'm okay because I'm the same as I was yesterday and the day before that and the day before that, and I really do want to get back to play, so I'm okay. Neuronal injury that Dr. Geiza has described very well. The brain needs energy to recover. This is another description, if you look at this, what does the membrane pump need? It needs energy. What's the mitochondria need? It needs energy. What do the calcium pumps need? They need energy. All of this can be answered by supplying energy. It's fascinating to see that they show that cerebral blood flow is significantly diminished to the 7 to 10 day mark, and that's why we count our concussions as 7 to 10 days. So let me speed up a little bit. So in my life, it was just insanity. Same thing, same results, take a chance, make a change. Ted Fogarty invited me to a meeting in Fargo, North Dakota, and my exact words were, "I'll go to the meeting, there's no way in hell I'm moving to Fargo." That meeting was January the 14th, and I forgot Ed DeGuillermo was also at the meeting when I was getting pictures ready, but Rusty Orts was there, Dr. Harch and his wife. But Gary Tharaldson is North Dakota's first billionaire. And he said, if you build a clinic, or I'll build a clinic if you'll come. We opened the clinic 6 months later. So for the past year, I have been working in the clinic, and I am ecstatic to say that we have data. I didn't check it twice. I spent this last week with my son, so forgive the Santa Claus if you don't believe in Santa Claus, but I just wanted to let everyone know this data is not perfect, but it's pretty darn close. In the past year, we've had 144 acute concussions, 99 males, and 3 of those males returned for an additional treatment, 42 females. We have had 103 responses a month out that they have no symptoms. This is greater than 70%. 35 haven't responded, and Meg from the lab, it is not for lack of trying. We've sent emails, we've sent letters. My assumption is they are so busy living their lives, enjoying their sports, they don't have time to answer to how well they're doing. We've had 3 that are not completely responded. Part of getting good data is to make sure that the patients didn't have to pay for their treatments themselves. So we teamed up with the Dakota Medical Foundation. Gary initially put in $100,000, and I think the latest we've now climbed to over $400,000, which we've probably spent more than half of. But keep in mind, we were going against standard of care, which has been difficult with the geography of North Dakota. So 2 of the patients stopped treatments when I had said, you still need to come back, you're not completely better. But they lived 2 hours away, they couldn't afford the hotel, mom had to get back to work. We all deal with, it's not just the patient that we treat. One patient truly, after 17 treatments, was still having symptoms. She was pushed down at the Fargo Dome, and her mother said that she watched her head bounce on at least 3 of the concrete steps. So a significant injury. She, last week, filled out the post-concussive symptom survey and only scored an 18, which if you're familiar with kids with post-concussive syndrome, that's not too bad of a score. She's by definition a failure, but she was able to complete the entire rest of the school year and was too busy over the summer with summer vacation to come in for additional treatments. We've had 3 repeats. 2 of them came in, had only 1 treatment, but they've had so many concussions before, they got hit again, they got scared, and they came in. But I love that. Out of 144 concussions that we've treated, the average number of treatments is less than 4, 3.8 treatments. And I'll show you why that's important in a minute. Are repeat concussions worse? Half of our patients, well, not quite half, 10 didn't answer, 77, it was their first concussion, but a significant number of patients, this was their 2nd or 3rd or 4th. 2 patients, it was their 6th concussion, and ironically, both of those are the guys that came back in after a hit, only had 1 treatment, and were okay. So that's by no means good data. That's just that they recognize they're not going down that path again. Days from injury that kids presented to our clinic. This is the slide. We are changing the standard of care in Fargo, North Dakota. more than 74% of patients came within the first 4 days of their concussion, and that's what I love. The average number of treatments didn't really change based on their presentation, but it'll take a statistician to look at it because there's a lot of variables, and I've clearly talked too much, so let's race through. Males and females, we saw a lot of patients with a history of ADHD and anxiety, but they weren't worse. We've had no complications. A few patients had needle pokes in their ears. We can talk about that later. But the Center for Disease Control talks about a pathophysiologic process. It's a functional injury, and that's why we need a diagnostic. And thank you so much to Right Eye for being here, and Melissa, and this has truly made our data. So quickly, this is a 13-year-old, and you can look at his score, but if you just concentrate on his brain IQ score of 37, he improved in 4 days and 4 hours to a brain IQ score of 78. This is not something he could fake. And we have data that Melissa can go over, or Barb can go over. We have statistically significant data. If you look, they're supposed to follow a circle. We have different aspects of that are statistically significant in their improvement. Fixation, you guys can see on the left, he's not looking in the circle, whereas he is on the right. A football player before and after one treatment. After 3 treatments in 24 hours, he went from a score of 48 to 77. This is not by chance. Our one failure, when she came back in, was better than when she left after her treatments. So we are still making sustained progress. So with all this data, why not treat? We know it's safe. Many people say cost. With 4 treatments, Medicare rates would be $1,000. The economic burden, they had a greater than 60% rate of post-concussive kids at $3,557 apiece. So if we look at treating all of the 247 in their study with hyperbaric with 4 treatments, because that's our average, we're looking at a little over $250,000. If we look at just what they spent on the post-concussives, not anything for the 93 that weren't post-concussives, it's over $500,000. So as long as private insurance is not twice Medicare, we are clearly cost-effective in treating all. And what does treating all mean? Medical precedence is that every strep throat we treat. We give IV antibiotics to everyone we operate on. When I trained, we used to say we needed an 85% positive rate on appendectomies and a 15% negative rate in case we were missing. If we didn't have at least 15% negative, we were missing them. This is general surgery and an operation. And so over-treating is okay. Vaping is FDA approved. Need I say more? There have been 11 deaths and everybody's making a big deal out of it. How many of our athletes have died from suicide based on previous concussion? So can we afford not to treat? We had a suicidal college student, an honors college student, went away to college, got another concussion playing hockey. This was over the summer. His parents were tearful when he was in the chamber and said, when the house is quiet, we go to look for him and we're not sure how we're going to find him. But in 12 treatments, he went from an IQ score of 70 to an IQ score of 86. And you can see red is bad, green is good. He got rid of his red and went to green. We can go over these later, or we can try to have some at the right eye table. Here's an adult, IQ score of 21, goes to 77 in about 12 treatments. 31-year-old from assault, who needs a control when you come in with a objective data of what your new baseline is, and then 21 days later, you're off the chart in a good way. The expression in surgery is better lucky than good. I had an NHL player in the first 2 years of his contract come to Chicago, but his parents didn't want him to come alone, so he brought his friend. They are affectionately known as John Doe and Buddy Doe. The friend had a cold and couldn't get to the depth that we wanted, but John fortunately was able to do the protocol that I've worked backwards for the post-concussives from what we know from the acutes. John improved, and Buddy didn't. So an N of 1, but clearly there's an opening for much more study in what we do with our protocol. This is an acute on chronic. He was our lowest score with a 7. But when we get to the correct depth, it's as if the clouds clear. And I'll skip through this. This was 2014 with animal data, but we know that we turn off inflammation with hyperbaric oxygen. We know post-concussive symptoms are related to inflammation. We know that the risk of a repeat concussion increases when you've had a concussion. And this is the other really exciting aspect of our data, is we are not seeing it. CHOP did a study looking back, and in their 2 years from their concussion, they found 1 in 6 had a recurrent concussion, looking at the electronic record. But in the 12 to 15-year-olds, it was almost 1 in 5. Multiple concussions. We're not seeing it. We can treat it. We turn off the microglia activation based on animal studies. The limbic system, Dr. Maroon went into this. This is why these kids are committing suicide. They have damaged brains that are not functioning correctly. Why treat a concussion? Faster recovery, decrease subsequent concussions, long-term problems. It is cost effective, and we can't not do it because of suicides. Here's one last slide, and I may have to be cut off, but I'll keep going. But this gentleman presented, and Dr. Bieberdorf asked him, how's your vision? I'm okay. Well, his okay was a 32. 2 days later, after 4 treatments, his vision score was an 82. Dr. Bieberdorf said, how's your vision? He said, I can see now. Well, you said you were fine before. No, I couldn't see at all. Again, these kids don't know. They don't know the extent of their injury, and it makes sense that the brain can't report. So in Fargo, in January, we were fortunate to have $330,000 slipped into the budget by the back door because the House approved it completely. The Senate fought it for various reasons. And Fargo, North Dakota as a state is just an incredible, everyone should work, everyone should help out their neighbor. We're all in this together, and they wanted to make it happen. Senator Kramer has visited the clinic. Senator Hoeven got the Fargo VA to be the 5th VA site for the pilot program, and we are really in the catbird seat, because if the VA pilot was doomed to fail, the fact that we're in it, we can show that. As Dr. Beckman has put out to everyone, the Senate and the House both have the same bill trying to allow hyperbaric for all veterans. Forget the pilot study. And on Tuesday, Secretary Wilkie is due to come to Fargo, North Dakota to make a visit and to talk about different things with the VA, but one of the things he will be talking about is hyperbaric for the veterans. Where do we go from here? We need to make this standard of care. We need standard protocols so that we can compare apples to apples to apples. We need standard testing. We use the ACEs form because that's what everybody else uses, but we also use the right eye because it's objective data. But we need multiple centers so that every time someone says no, we're able to say, well, how about another 100 patients? Well, how about another 100 more? And it's incredible once the word gets out. We had a kid last week who came in and he said, I think I'm okay, but 3 of my teammates said, dude, but you better go get checked out. You need a treatment. And he comes out and he's like, I needed a treatment. And our basis is sustained symptom-free. So we treat them twice a day until they are able to come back in and say, I don't think I need this treatment. We treat them, they come out, and they say, I didn't need this treatment. And that's the best way to know the inflammation is turned off and they're good to go. So sustained symptom-free is what we say. And that's why we need an insurance pilot. or we need a not-for-profit model like we had so that the patient doesn't have to pay for each individual treatment. Because when Johnny looks a whole lot better and mom says, I can pay for this treatment or this, and you're kind of okay, you're a whole lot better than your friends used to be, you don't need another treatment. We need to take that decision out of their hands. And the education to the kids, if you are a little off, get a treatment. If one treatment, it doesn't show a change, you didn't need it, and one over-treatment of pure oxygen under pressure is a whole lot safer than the Kelly Catlin and the Jack Hen. So a huge thank you. Thank you to Ted, and working with Dr. Bieberdorf over this past year has been phenomenal. And a huge thank you for Megan for trying to track down our data at all times. And our clinic is often open from 5:30 in the morning until 5:30 to often 7 p.m. at night. And my staff is just wonderful because the just show up and Denham will take care of you really trickles down to the staff staying around late too. So thank you very much. I don't know if there's a microphone, but it completely depends. We treat acute concussions with an acute concussion protocol. We do post-concussive with a post-concussive protocol. The acute on chronics are another different protocol. Most of them are 60 to 70 minutes in the chamber, but especially the acute concussions, if they are getting better and we're not already 30 minutes behind in clinic, we give them another 10 minutes, because if they can come out completely symptom-free, then they're less likely to need another treatment. And all of those are things that we need to continue to sort out. But we have multiple different protocols, which is why when I went to Fargo, one of the things that I was blessed with was that James, one of my hyperbaric technicians, went with me because he knows all the protocols. And when we open other centers, I have other technicians who've said, I'll go with you. So there's a whole manual waiting to be written on what pressure and how long. Yes, sir.
Back when I played high school football back in 1878, we used to have to get insurance and a doctor's exam and all that in order to compete. I was wondering if you presented your data to high school sports insurers and have them cover.
We did invite all of the athletic trainers to an open house at the clinic in Fargo, and I am sad to say that the athletic trainers in the city of Fargo were not able to sign on to sending patients to us because of a hospital system and their physician oversight. So our program actually started growing because of Mike Callahan out of Valley City, who Mike's son committed suicide about a year before we opened the clinic. And Shane Callahan, as I have told Mike, is a huge reason that the Fargo Clinic exists. But Mike was sending patients were getting better, and North Dakota is a big state, but it's a small community. So word started getting out, and now kids are hearing about it, not from their athletic trainers at school, but from the other moms. We've talked to an insurer about doing a pilot study. Initially, they said I didn't have enough data. Now that we have much more data, we're going to try to readdress and see if we can do an insurance pilot study. But I don't know that there's the separate insurance that there was. I wasn't far behind you in 1878, although I didn't play football. But I know we were offered insurance as students in school, and I think much more with Obamacare and everything else, it's different. There have been talks of people offering concussion insurance. What I would personally like to see is that each team has a fundraiser, donates money in honor of their team, and takes a team approach of let's put in $1,000, and that way we know that if any of our teammates are injured, we as a team are going to make sure that our teammate is able to play his or her best. So all kinds of potentials, but yes, we're trying to go down those avenues. Yes?
It sounds like you titrate the time. Do you also titrate the pressure?
We do titrate the pressure, and the titration of the pressure is very patient-specific. We have a lot of communication with the patients while they're in the chamber. And some of them are good with the communication, and many of them are a little perturbed because we do have them watch television. My favorite show for them is The Office, and when it goes off of Netflix, I'm not sure what we're going to do. But The Office is one-liners, it's these vignettes, and it is the music constantly. So patients tend to respond better with shows, and you can ask the techs. I have acute concussion approved shows and unapproved shows, and I really don't like coming in and seeing an acute concussion with an unapproved show. Anything with bright lights, flashing, a plot, suspense, we don't want. We want one-liner comedies that if they can't pay attention to it, they're fine, but the music is soothing. Friends is another one that some of the girls like. Not to be gender specific, but not too many of the guys like to watch Friends. They all like The Office. But we are in communication with them frequently. So we start low, and we build up, and we make sure that they can take it. And it's phenomenal. As I said with the clouds clear, it is incredible to watch these kids because so many of them are squinting to watch TV, but they're so addicted to TV and they haven't been able to watch TV. And I always say what goes on in the chamber is not reality. Just because we let you watch TV in here does not mean you get to go home and watch TV or your phone or whatever. I tend to think that we push these kids back too soon. And I had that out with the concussion gurus who actually quoted the international study saying that we don't know how much rest to give as the reason to send kids back to school the next day. And that's when I knew I was just banging my head against the wall, and we had to have data and just go around them. But, there's a lot of different things that go into each individual treatment. Yes, sir.
Me?
You.
Have you had anyone come back who had a concussion, from 15 years ago that didn't get treatment and now wants treatment? Have you seen anything like that?
We do a lot. In the year that we were in Fargo, we pulled the codes, and we have treated 853 patients in 1 year that had some form of brain injury or another. That's a busy clinic. And that's in a community that recognizes we're onto something. So, one of the slides that I showed was a patient, I just blew through it, but he had 12 treatments, and yes, he was years out from what he says is over 100 concussions, but was suicidal, having problems, and his I-score went from like a 21 to 77. I mean, dramatic improvement. But again, we titrate and do differently than 60 at 1.5.
Good job.
Thank you.